Well, I want to thank everyone for coming to today's event. Professor Molly Secor-Turner will be presenting Politics of Sex Education in North Dakota. We usually don't do this late of a forum, but the reason that we were interested in this is because when the talking was going on, it was really hard to understand what was actually happening, what was the issues. I knew the research and I could not find any discussion of it. So I wanted to hear more about this and also Professor Secor-Turner's experience with this. By the way, my name is Dennis Cooley. I am the director of the Northern Plains Ethics Institute. Our mission is to inspire democratic participation on social and ethical issues affecting the Northern Plains and beyond. This is clearly one that satisfies both of those. Before we have our discussion and before we begin, the NPEI has two main rules on how to engage in conversations. Conversations that are rigorous, thoughtful, challenging, yet civil at the same time. The first one is called questions of meaning come before questions of truth. Before we evaluate, we always try to figure out exactly what the other person is saying. We have to understand before we can evaluate. Just like you read the book first time to understand, second time to evaluate. That's what we do here. The other one is we use what's called the principle of charity. The principle of charity is a way of interacting with each other, even if you don't particularly care for the other person. So what you do is you assume the other person is intelligent, has important things to say. You try to strengthen their position as much as possible. You evaluate then based on evidence. The evidence matters, not personality or anything along those lines. So we look for strengths and weaknesses with their positions, their arguments, and then we draw a conclusion based primarily on reason rather than emotion. All of that being said, I'm looking forward to a really good conversation and I'm looking forward to a really good presentation. I would like to introduce our speaker. Using both qualitative and quantitative approaches to her research, Professor Molly Secor-Turner explores methods to improve adolescent health through reducing risk and building protection in the lives of youth. Her work focuses on how social context shapes adolescent sexual health, access to youth-friendly health services, and global health. For nearly a decade, she has led the implementation and evaluation evidence-based comprehensive sexuality education in community settings across North Dakota. She's particularly interested in understanding how tailoring evidence-based strategies to context can help improve health outcomes for at-risk populations of youth. Professor Secor-Turner received her PhD in nursing from the University of Minnesota in 2008, and she is currently a professor in the NDSU School of Nursing and Department of Public Health Community Health Sciences specialization. She's a fellow in the Society for Adolescent Health and Medicine. She currently serves as the NDSU Faculty Senate past president. So we usually welcome our speaker. Welcome, Professor Secor-Turner, and we turn it over to you.
Thank you, Dennis. Good afternoon. So sex education, a necessary, uncomfortable, and highly politicized topic. Although sex education has been a part of American education since the 1970s, there has been accelerated debate about the merits and content of sex education ever since. Today's talk will provide an overview of how politics has shaped sex education in the United States and more locally here in North Dakota. Despite generalized discomfort talking about it, sexuality is an innate part of being human from birth until death. It is just as much a part of our health and well-being as our physical, mental, and emotional health. Each stage of child development includes sexual development markers. Of course, the hallmark of sexual development is puberty that occurs during adolescence. In order to support the healthy development of adolescents, it's necessary that we attend to their sexual health and development. This rapid phase of sexual development often leads to engaging in sexual behavior for young people. Although many of us would prefer to keep our children forever young, the truth is many young people engage in sexual behavior, and the majority of people in the United States engage in sexual intercourse before marriage. As you can see in the chart on the left, nearly 2/3 of adolescents have had sex by age 18. And by age 25, over 95% of adults have had sex. That's approximately 2 years before the mean age of marriage at age 27. While we are often uncomfortable and avoid talking to adolescents about sex, they are bombarded by sexual content and sexual messaging every day. While media frequently portrays sex as pleasurable and without consequence, messages young people get from adults often position sex as dangerous. This is confusing to young people as they navigate their sexual development. It turns out young people consistently report wanting information about sex, sexual decision-making, and sexual health. And they want this information from their parents, teachers, healthcare providers, and faith leaders. Even though we all know about the sexual health and development needs of adolescents, many of us probably had sex education that experienced more like this. Turns out this approach to sex education isn't actually very effective. Based on over 30 years of data, the CDC has identified critical elements of quality sex education, and those include building both knowledge and skills in young people to avoid HIV, STDs, and and unintended pregnancies, that it includes medically accurate, developmentally appropriate, and culturally relevant content and skills, and that it should be based on science and best practices. So in the 1970s, when sex education began in public schools in America, there were very few guidelines and little data about knowing what kind of program was effective. So beginning in the 1980s, sex education was integrated into federal policy through funding streams reflective of political ideology. This was the beginning of the politicization of sex education in America. It started with the Adolescent Family Act, a part of the Reagan administration's welfare reform. It was established in 1981 and funded sex education programs that focused on self-discipline and used fear tactics to enforce abstinence by doing things like negating the effectiveness of condoms and contraceptives. Next, in 1996, Congress created the Title V abstinence-only-until-marriage program. This program provided block grants to states to implement abstinence-only programming. The grants required that states match $3 for every $4 they received from the federal government. And the program required that grantees made abstinence outside of marriage the expectation, and that programming emphasized psychological and physical harms to sexual activity outside of marriage. Frustrated that more progressive states were not accepting the Title V abstinence-only-until-marriage funding, in 2000, Congress created the special programs for community-based abstinence education grants. These grants could be awarded directly to state or community organizations. This allowed organizations in states that did not support abstinence education to deliver abstinence education in those states. These programs developed a stronghold for abstinence education in the United States. The Title V abstinence-until-marriage program created a working definition of abstinence education called the A to H definition that was used as a standard for these programs. You can see here that the emphasis is exclusively on abstinence from sexual activity, and it emphasizes dangers associated with sex outside of marriage. It provides no education for young people on how to be healthy if they do become sexually active, or even when they do become sexually active in marriage. Further, it placed significant emphasis on marriage to make sexual behavior acceptable. Keep in mind, during this time, same-sex marriage was not legal in the United States, essentially making same-sex sexual behavior never acceptable. In response to the mounting widespread abstinence-only education, experts began to wonder if this was actually working, since there was little decline in teen pregnancy rates during this time. In 2004, Representative Henry Waxman from California ordered an evaluation of content in the most widely used abstinence education curricula, resulting in what became known as the Waxman Report. The report found that over 80% of abstinence education curricula contained false, misleading, and distorted information, including 2/3 of the programs funded by the federal government. For example, the programs inflated failure rates of contraceptives and risks of abortion procedures. They conflated science and religion and treated gender stereotypes as scientific facts. Next, Doug Kirby and colleagues published a rigorous review of the efficacy of sex education programs. The study included comprehensive and abstinence sex education programs. The review revealed that comprehensive programs were significantly more likely to delay initiation of sex, reduce frequency of sex, reduce number of sexual partners, and increase condom and contraceptive use compared to abstinence programs. In response to this report, and with a change in administration, the Obama administration created the Teen Pregnancy Prevention Program and Personal Responsibility Education Program housed in the Department of Health and Human Services. funding from the community-based abstinence grants was transferred to the Teen Pregnancy Prevention Program to support the creation and implementation of evidence-based sexuality education programs. The Personal Responsibility Education Program, or PrEP, which you'll hear more about later, funded grants to states and tribal nations to increase the use of evidence-based programs at the state level. As you can imagine, there was political pressure to bring abstinence-based education back to the forefront and to transfer funding back to abstinence education. So in 2012, Congress created the Sexual Risk Avoidance Education Program. Again, this program bypasses states and provides funding directly to community organizations, including many faith-based organizations. This was kind of a tricky move, as proponents of abstinence education knew that abstinence had largely been discredited. So they rebranded abstinence education to sexual risk avoidance education. Then in 2016, the Trump administration made a bold move to turn abstinence education as a priority for the federal government by canceling teen pregnancy prevention program grants that were only in year 3 of a 5-year funding period. They did this by saying that they were not showing any effectiveness. Well, most of them were not even to the point of evaluation of their programs yet, so obviously they weren't demonstrating effectiveness. So the Trump administration took away their grant funding for the pregnancy prevention programming and told them they had to instead implement one of 2 abstinence-based programs. There have been subsequent lawsuits against the administration for that move. But lastly, the nail in the coffin for the return of abstinence-based education was when Trump appointed Valerie Huber, former CEO of Ascend, an abstinence education organization in the US, as Assistant Secretary of the Health and Human Services. So despite having science that tells us how to implement effective sex education, the US has insisted instead on relying on politics and ideology to guide our policies and funding for sex ed. You can see here on the top, the pattern of funding for abstinence and comprehensive sex education closely follows changes in our presidential administration. The lower slide shows teen birth rates in the US, the gray vertical bars, with funding streams mapped on top. As you can see, over a decade of substantial investment in abstinence-only education did very little to impact our teen birth rates. And you can see when we began investing in comprehensive sex education, the smaller line toward the right, and providing less funding to abstinence education, the teen birth rates began to decline more steeply. So what's the problem with abstinence education? On the one hand, we can all agree if young people are not having sex, then the risk of teen pregnancy and STDs is eliminated. However, we also know that sex is a basic part of being human, and we know that adolescents engage in sex. So there's a disconnect between our expectations and reality. And this is why abstinence education is ineffective. Multiple reviews of abstinence programs have found no evidence that these programs increase rates of sexual abstinence. In fact, several studies suggest they may increase the risk of pregnancy and STDs when young people do become sexually active because they are not equipped to protect themselves. This is truly unethical to withhold this critical, potentially life-saving information from adolescents. These programs also teach gender stereotypes as fact, emphasizing feminine passivity and sexual restraint while linking masculinity with intense sex drive and aggressiveness. This is dangerous for young people as it perpetuates acceptance of non-consensual sex. In addition, these programs typically emphasize and normalize heterosexual relationships while excluding or condemning LGBTQ youth. Finally, these programs are based on judgment, fear, guilt, and shame associated with sex. This is all happening as young people are trying to navigate their own sexual development and experience their sexuality as fundamental to part of their humanity. Even though we know these programs are at best simply ineffective and at worst harmful, the federal government has spent over $2 billion on abstinence education since 1981. This continues even though most Americans overwhelmingly support comprehensive sexuality education. Even across political, religious, and regional divides, parents again and again report that they want their children to have education that promotes abstinence and includes information on birth control. Teachers, students, and professional medical and public health organizations all agree. Yet the discourse around sexuality education is consistently centered around politics, religion, gender, sexuality, and often linked to abortion. This discourse in the United States has largely been dichotomized between conservative versus liberal. Conservative discourse has reflected expectations of self-control, biological essentialism, and sexual morality, while liberal discourse has emphasized a rights-based approach that normalizes sexuality and prioritizes medical accuracy and scientific evidence. This discourse and the impact of federal funding has directly impacted sex education in North Dakota. In 2012, the state century code was amended to add language requiring abstinence-based sex education. Each school district is required to include instruction on the social, psychological, and physical health gains to be realized by abstaining from sexual activity before and outside of marriage, language that mirrors federal abstinence-only education programming. So although North Dakota has health education content standards related to sexuality education, the state leaves it up to local school districts and teachers to decide the quality and content and alignment with state law. This results in significant variation in the quality of sex education in the state of North Dakota. The result of local control is significant variation. Here you can see that nearly 3/4 of students in North Dakota did not receive all 20 sex education topics considered critical by the CDC. More students, about 80%, were taught about abstinence compared to fewer than 30% who were taught to use a condom, or 55% who were taught about other methods of contraception. And less than half of students in North Dakota received information about sexual orientation, gender and gender identity, or materials that included prevention information for LGBTQ youth. Not receiving this information isn't working for the youth of our state. When we look at teen birth rates in the US, there has been a steep decline by nearly 50% in the last 2 decades. The teen birth rate in 2020 in the US was the lowest it has ever been since we've been keeping track. But that isn't the case for North Dakota. During this time, North Dakota saw a much more modest decline in teen birth. Although North Dakota once had rates nearly half that of the national rate, rates in North Dakota are now even with national rates. We are seeing similar patterns in other more conservative states. When you compare declines in state teen birth rates by political ideology, the chart on the right, you can see that although declines happened similarly across time, teen birth rates in more conservative states remained higher compared to moderate or liberal states over time. So remember the PrEP funding I talked about earlier. This was the funding established in 2010 and offered to states to implement comprehensive sex ed. Well, it turns out 5 states, including North Dakota, refused to accept this funding and instead only accepted the abstinence funding, which required the state dollar matching. As a result, the federal government turned those funds into competitive grants open to other organizations and agencies in those 5 states. So in 2012, Dr. Brandy Randall and I submitted an application for this funding. The funding requires implementation of programming that uses one of 44 Health and Human Services approved evidence-based comprehensive sexuality education programs. In addition, the program must include emphasis on abstinence and include adulthood preparation skills. So in partnership with Planned Parenthood of Minnesota, North Dakota, South Dakota, for the last 9 years, we've implemented this program directly to use using 3 different evidence-based models. In addition, we have supplemented funding to provide training for parents and other youth-serving professionals to become skilled in sex education with their own children and the youth they serve. Planned Parenthood provides the skills and experience with implementation, and faculty from NDSU provide the evaluation and research program activities. Since 2012, we have reached over 600 youth in community settings, excluding schools, who have participated voluntarily and with parent permission. Because we train the youth to be peer educators and track their contacts with other youth, we have been able to amplify our direct reach to over 2,000 youth through peer education. In addition, we have had nearly 600 teachers and other youth serving professionals and 139 parents participate in our adult programming. And guess what? These programs are effective. Youth who participate in our programming have increased sexual health knowledge, awareness of sexual health resources, increased comfort talking about sex with parents and partners, increased intentions to engage in less risky sexual behavior. And the adults who participate in our programming consistently report high levels of satisfaction and genuine gratitude for helping them become more skilled at keeping their youth safe. Yet this program has been consistently under attack by political opposition since it began in North Dakota. First, at its very genesis in 2012, the funds were temporarily frozen when legislators suggested the partnership with Planned Parenthood violated a section of the state century code that forbids state funding going to an agency that performs, refers, or encourages abortion. The Attorney General later ruled that section of the state century code unenforceable because it had been invalidated as unconstitutional. Then in 2019, NDSU received a letter from 89 legislators and 2 organizations, the Concerned Women for America and the Family Policy Alliance, that urged termination of this partnership. Among other accusations, in the letter, the executive director of North Dakota's Family Policy Alliance suggested the program focused on abortion and encouraged abortion among youth. This is simply false. At the same time, other opposition groups continued to misrepresent the program content by suggesting sex education only focused on contraception and suggesting appropriate sex ed should exclusively focus on self-control. In response to a training for teachers, the Concerned Women for America, North Dakota, decided to focus specifically on a book, and it's called It's Pretty Normal, to misrepresent the work of our programming. This book, pictured here in the bottom right corner, is a cartoon book. It provides medically accurate and comprehensive information. It was listed on a list of resources for teachers who took this course, as optional and as a reference that adults could use to have conversations with youth. Instead, this organization has suggested that we were distributing this book to kids in schools and consistently commented that it is a graphic novel that shows pictures of sexual positions, encourages abortion, and encourages homosexuality. Again, simply not true. This is a standard book used in sexuality education all around the United States. In fact, I have this book in my children's bookcase at home. Next, this legislative session, this information and opposition surfaced in amendments to Senate Bill 2030. Senate Bill 2030 is a bill to provide funding for a challenge grant to fund student scholarships at the state's 11 universities through a matching program. On the Senate floor, Senator Muradal added an amendment making institutions ineligible for funding if that institution was sponsoring, partnering with, or applying for grants with any organization that performs or promotes an abortion, and is also they cannot be participating in any program producing, distributing, publishing, disseminating, endorsing, or approving materials from any organization that between normal childbirth and abortion do not give preference to normal childbirth. This amendment was specifically added to the bill to target the grant between North Dakota State University and Planned Parenthood. The House Appropriations Committee later added a $2.8 million penalty and misdemeanor charges for violation of this law. Most recently, the bill passed out of the legislature and Governor Burgum vetoed the extreme penalties, but the restrictions of the bill persist. The entire debate around 2030 exemplified the ways in which sex education is politicized in North Dakota. Guided by misinformation, the program was consistently linked to abortion, a topic not included in our evidence-based programming, and reported to be in violation of state law. Even the governor's veto letter perpetuated these false misrepresentations. He states that the North Dakota legislature has made clear, and our administration agrees, that taxpayer funding should not go toward funding abortions. Challenge grant dollars have not and cannot be used for that purpose. Again, this perpetuated the idea that somehow this grant had something to do with performing abortions, which it never did and never will. Also left out of the debate were the facts and evidence. Very little to no time was spent discussing the effectiveness or positive outcomes of the program. And opponents continue to link the program to abortion, despite this NDUS compliance report that verified through a curriculum review that the programming did not involve abortion. The report also verified that the program was not in violation of any state laws or restrictions. So, quick overview of the politics of North Dakota. I hope that you can agree in my conclusions that political meddling into sex education, it's not new and it's not unique. But what is clear is that the North Dakota legislature continues to make laws based on misinformation and political ideology while disregarding evidence and science. This is dangerous for the youth of our state. We know it places them at risk for unplanned pregnancy, STDs, sexual exploitations, and the associated long-term consequences. We also know that providing them medically accurate, safe, and effective education about sexuality can help them grow into healthy adults. Playing politics with sex education is unethical and is an injustice to the youth of North Dakota. Thank you.
Thank you very much. So what we're going to do is, if you have a question, if you would put it into the chat, start off with, since we've been talking about this, we were putting this presentation together. I was trying to figure out what the heck's going on. What's the underlying issue here? Because what you're talking about, I think most people who are against abortion should love, absolutely love it. The reason why is if people don't get pregnant, then there's no abortion that can possibly happen. There's non-existence. So it makes sense. But when I was looking at some of the responses to your testimony, it was almost as if they were in a different room, that somebody else was talking to them. Do you want to speculate, or what the heck was going on here? Because it's clear that something was happening other than a real conversation about what's occurring between you. What do you think? What do you think that might be?
I think that it's a single issue focus, and that focus is being committed to having a pro-life stance. And for many of the opposition organizations and the legislators who oppose this partnership and the work that's being done, they are focused exclusively on abortion. And I mean, I can't really understand exactly why they can't hear the information that's being given to them to tell them that abortion isn't a part of this. And, you know, they're so concerned that money is going to Planned Parenthood to support abortions. Well, it turns out that Planned Parenthood in North Dakota doesn't have a clinic here. The only work they do in North Dakota is education. And so they have to use the funds that are given to them through this grant funding to be used on the education side of things. It's a very careful documentation. We've shared all of the documentation of the funding, the contracts, to show that none of this money is being used for abortion. So it's frustrating that they don't seem to comprehend that. And it's even more frustrating what you alluded to at the beginning of your comments, that this is a win-win situation for everyone involved. If you want to prevent abortion, the easiest way to do that is prevent pregnancies. And we know that how we prevent pregnancies is either help young people remain abstinent if that's their choice, or help them understand how to have access to effective contraception. And so when we've seen the declines in teen pregnancy over the last couple decades, what we've been able to demonstrate, the most rapid decline that happened with comprehensive sexuality education, is that young people had better access to contraception. And that's why we saw declines in teen pregnancy, and we saw declines in abortion rates at the same time.
So I'm going to push it a little bit more. Look at the difference between the issue of abortion versus same-sex marriage. So in my lifetime, I never expected to see same-sex marriage. I literally never thought it would happen, because there's so much hatred, and now it's more along the lines of, in a lot of areas, people are saying, well, we're not going to talk about it, but who cares? Although I have heard in Fargo, a same-sex couple called an effing queer and Cashwise at a cash register. So there's some ugly stuff here, but I don't see this having the legs that the abortion issue does. Roe versus Wade is in the 70s, and it's still this. Did you see this as it's been made into this huge thing, and then you just have to keep it? You have to keep it as a matter of purity. Or I'm being unfair to you, but I find this interesting that there's a huge difference with what seemed to be completely prohibited. Now, oh, okay. But this one issue, no, we cannot even think about it.
Well, yeah, it's a very nuanced way of, if you start thinking a lot about the ways in which this is positioned, right? Because it's not really about, it's about preventing pregnancy, and that all is highly linked to a lot of gender issues. It's linked to women's bodies. It goes back down to controlling women, saying women are the ones who should maintain purity and virginity in the name of preventing pregnancy, because men don't have the same outcome as pregnancy. So even that conversation is different, right? So it starts at a different place, I think, than conversations about marriage, because it's more about gender. It's also, if you look at the Welfare Reform Act, that when abstinence education first started happening, that was really an attempt to try to eradicate poverty. It was also really highly linked to race, class, and gender. And so that reform started, and the abstinence movement came into that. So I think that this kind of abstinence-based education is a part of the stronghold to trying to control the morality of the United States. And I think that it's kind of a beacon of representing that. How do we control morality?
I see Ken Lepper has a comment. Ken, are you still around? Would you unmute so that you can make your comment?
I observed during this process that the media could be playing a role of informing the public and providing that correct information. But it's every article I read, and occasionally I watch news on TV, it always included abortion, abortion, abortion. Even when they covered our rally that we had on campus, it included abortion, and it was an academic freedom rally. So the media is just, rather than informing, they're perpetuating the problem. Do you want to comment, Molly?
Yeah, I mean, I think that absolutely has happened throughout this entire process. Every headline that involved anything about this grant or about the Senate bill included the word abortion in the headline. And I guess that's just a way of sensationalizing. And I think it certainly contributes to the greater politicization of sex education and polarization of being able to talk about the topic. At the end of the day, everyone's agreeing on the same thing. We want to help teenagers avoid getting pregnant, and we want to help teenagers avoid getting STDs. So it's really not as dichotomized as it's presented to be. And I think you're right, the media certainly perpetuates that strong dichotomization.
There's one from Kent Rogers. Kent, are you there? Do you want to ask your question about polls?
Sure.
Yeah.
Sure. I'm just wondering, I did a little bit of digging, but I didn't have time to go too far into it. Does anybody know for sure how North Dakota currently polls on the abortion issue? From the numbers that I was able to find, all the statements about North Dakotans being firmly against abortion doesn't really hold water.
Yeah, the most probably relevant example we could use that would be more representative of North Dakota voters in general, not just the legislators, is when we had our Measure 1 ballot initiative that would have given full human rights to a fetus. And that didn't pass by a 2/3 majority in our state. So if the claim were to be that all North Dakotans are firmly pro-life, that should have passed by a bigger margin and not failed by such a large margin. So I think what you're suggesting, Kent, is absolutely right, that there is it's portrayed often that North Dakota is always staunchly pro-life on every single issue, but I think there is more variation in the ways that people express their views on abortion.
Yeah, the numbers I found I concede are a little bit old, but based on those numbers, the state is pretty much split right down the middle, 50-50 almost.
Right on topic, Mimi Meredith, thank you for putting that in. There's she provided a link to the religious landscape study comparing views about abortion by state. So that is in your chat. I want to go back to Amy Phillips, though. Is Amy there?
Yes, I'm here. You can see my question there. Yeah, I was just curious if any of because you do receive a lot of positive feedback from parents and teens about the benefits of the program. And does any of that translate into advocacy by those parents and teens on behalf of comprehensive sex education to state legislators? Did any of that happen this year?
Yeah, it's a great question. So we've had every year we've made kind of a fact sheet and included some of those quotes and information that we've used for advocacy work with legislators, and tried to deliver that to legislators to help them understand the impact of the program. You know, it's really too bad because the organizations that we work with, the young people, the families we work with, because this issue has been so politicized and so polarized, many of them are actually uncomfortable, despite thinking this is great programming, wanting to tell people how it is. They'll tell their friends and neighbors, but it's harder to find people who will stand up in front of a legislative body and say, here's what's really great about this program. At the individual level, it's a little bit, we have a few champions who have been able to speak out for our programs in different areas. But, you know, again, it's kids who are under age 18. It's kind of hard to find a 15-year-old who's willing to go to the legislature and testify on a political issue that draws a lot of harsh questions.
It's almost like there's a kind of bullying dynamic that's going along with this too, that prevents people from speaking up.
Mm-hmm. Exactly.
Well, and I think that's what Amy brought up is quite interesting. So even so, let's say that it is split 50-50. That means if you get up and you speak in favor of something like this, you got a 50% chance of people. So it's a flip of a coin. Why are people so reluctant to do this? Is there a difference in attitudes on how much force or violence can be used? That is, I mean, I'm talking about violence, not the physical one, but the going after your job. And I have a feeling that there might have been some of that going on for you. Or calling and doing all these nasty things to try to either cancel or to harm reputations and so on. Do you see a difference between, and I don't want to say two sides because I think it's more of a line, people fall somewhere on it. Do you think it's maybe there's a lot of extremists who will do anything? And that's why these folks over here don't want to say anything.
I think the whole sex ed debate is fueled by extremism. I think that, like I mentioned in my talk, the majority of Americans, parents, young people, teachers, medical professionals, all agree that comprehensive sex ed is important, that we should provide this information to young people. It's the small 10 to 15% of people who are adamantly opposed to this kind of education, link it to abortion, and only want to focus on abstinence, that are the loudest voice in this conversation and are able to consistently use tactics that tie abstinence-based education, or I guess conversely comprehensive sex ed, to more controversial issues. And that's their intention, is to make it more polarized and to pull people who otherwise would just go along thinking, oh, of course, comprehensive sex ed makes sense, that should be what it is. But when they add it to a polarizing issue, that's when they can pull people onto their side and keep control of the debate. And I think that's the strategy that's very intentional.
Oh, and speaking of intentional, I'm glad you raised that word. I wonder what would have happened. Philosophers always look at alternative worlds, not just what is the case, but what ought to be the case. When you're talking about ethics, you have to do that. You have to think that way. But what if it hadn't been Planned Parenthood? If it had been an organization that delivered the exact same services, but they were doing it because they wanted to reduce the number of unplanned pregnancies that would end in abortion, and they were a religious group, a very strong conservative religious group. By the way, I think as a conservatives, anybody who's a conservative says, yeah, this is great. This is the approach we should take. It makes perfect sense how to do this. So you have a religious group said, yep, that's what we're doing. Do you think there would have been a difference in the state?
I think there would have been a difference. I think the conversation would have been more difficult because it wouldn't have had the tie to what many opponents continue to say, that abortion, or that Planned Parenthood continue to reiterate that they're the leading provider of abortion services in the United States, which it turns out that Planned Parenthood is also the leader of sex education in the United States. They provide more sex education services than I think any other organization. So it's interesting to think that we would look at an organization only based on one part of their expertise. And so for me, yes, we could have had a different organization, but I think when you're doing work, you choose the organization that's best prepared and best capable of doing the work you want to do, which is why we partnered with Planned Parenthood. I think during the legislative session, talking about Senate Bill 2030, some of the legislators consistently said, well, can't you just do the work with someone else in North Dakota? Can't you just give the money to someone else? Well, it takes skills and expertise, and that doesn't exist in other organizations in North Dakota. And quite frankly, there are faith-based organizations that would work on this issue. The Universal Unitarian Church has a sexuality education curriculum that's one of the highest rated evidence-based programs. So we could work with an organization like that, but I don't think when conservative legislators say you should work with a religious organization, they're thinking about the UUC church.
Yeah, no, I think you're absolutely right. But this is, see, I think there's a study here. You know what it was with this particular group, then another one with a group that is more oriented to the others. Because I'm wondering how much of this is just unconscious. It's knee-jerk reaction, it's tribalism. You have to be part of the group and you have to act in this extreme, and they're not even thinking about it. It's a sort of a warping of reality.
Yeah, that, and a lot of the opposition to political issues that happen in North Dakota don't begin in North Dakota. They come from outside organizations that have a lot of influence in a state like North Dakota, because we have a large conservative voter base. And the Concerned Women for America organization and the Family Alliance organization, who have talked most openly about being in opposition to this, both have their talking points have been from other national organizations that are part of the opposed comprehensive sex ed movement. So they can say it's about abortion, but when they make reference to like the book that came up, that's something that's on that list of things that organization consistently opposes. So I think it's more nuanced than just saying like, what if we just found a different organization?
Kenneth sent a question to me. I'm not sure. I think Molly said UCC. I would guess the Anglicans would be one of the groups, but I'm not sure if you consider that to be strong. Amy has another question.
What is the impact? I mean, I know the penalties got removed, but what is the impact of the final version that was approved by the governor of SB 2030?
Yeah, so I don't think we are clear on what the direct impact will be yet. The chancellor has asked for a state's attorney general review of the bill so that we can understand more clearly what the bill actually means. If you look closely at the language, it's very confusing and convoluted, and it's hard to interpret. For example, it uses the word normal childbirth over abortion. It's not even clear what normal childbirth means. So I think as the law is written currently, it's very confusing and has the potential to make a really big impact on things, because people really have no idea when they'll be breaking the law or not, because it's so unclear. So I think that moving forward, we're going to need more clarity to understand the impact of the law. More directly, the law doesn't take effect until July 1st. So we're continuing our work in North Dakota, and we'll continue working until the grant finishes, as long as we're able to do that, which will be the end of September. And then are exploring other ways to keep doing this work, just in a different capacity.
Is anyone challenging the law? Is the university in NDSU or the university system going to challenge the law?
I think the chancellor's request of the review of the law includes understanding if it's even legal or constitutional to be enforced.
Candace Philbrook put in a comment in here. It's not a question, but it's something that I'd like her to share if she's willing to with everyone. Is Candace still here?
Hi, yes, I'm here. I teach in the Human Development and Family Science Department program on campus, which Brandy Randall used to be a part of, and so have known about the Reach One, Teach One program for a long time, and have had them come into my classrooms to advocate to be a part of the Reach One, Teach One program, and then after they complete it, I give them extra credit for it, have them write a reaction paper, and I can tell you that so many of them are so appreciative of the information that they received in the program that they did not receive in their high school program, and would say things like, oh, I thought this was going to be so uncomfortable and not fun, but I learned so much, and I'm so glad I was part of it. And so I just want you all to know that from the students' perspective, they need, want, and enjoy the information that you're giving them, Molly. So thank you for the program.
Thanks, Candace.
So there's a Sharon Secor, who I'm assuming is related to you. She mentions, I'm not going to say this, so if she would be willing to share her comment. She answers Ken's question, by the way. So is Sharon Secor here?
Yes, I'm here.
Okay.
I'm a proud mother of Molly Secor-Turner. Also, I was the youth director at the First Presbyterian Church for 15 years. And during that time, we had a comprehensive based sexual education course that was taught to the youth in our church. It included Molly when she was a teenager. And so in just a regard to the religious community offering this kind of a curriculum, I think that it is definitely something that people who care about living out their Christian-based faith tradition in a way in which they believe they are called to do are very willing and have been doing. I don't think that that answers Jane Myrtle's objection to her Planned Parenthood teaching this versus a faith-based community. Her intention is to promote her way of thinking and her opposition to Planned Parenthood. And so this was a way to get at that. I think the discussion about that most of the people in our state and in our country want this education for our children stands, and we need to stand for that. So thank you for having this.
Oh, I want to ask you a question. I know this is unusual as somebody who's made a comment, but it's really interesting what you just concluded, that it didn't matter. This could have been anything. And so I was going with, here's what the issue is, and they're just, we could try a different thing. But the way you're reading it is that it was Planned Parenthood is what was the thing. So if Planned Parenthood was in the state planting flowers, they would be, whoever was involved at NDSU with the planting of flowers would have been on the chopping block or at the whipping post. I think that's a better way of saying it. Is that what you're saying, Mrs. C, or
yes.
Is it Mrs.?
It is.
Or Doctor? Yeah. I prefer to call people by their titles since they worked hard to earn them.
Thank you. My husband and my daughter are the Dr. Secors.
Okay.
I'm the mother.
Well,
yes, I think you're exactly right. I think that this is a national effort to discredit Planned Parenthood, to bit by bit chip away at any federal funding that is given to Planned Parenthood. I think the agenda was, in fact, having listened to the comments during the testifying in the legislative committee, the people in the legislative committee kind of flew caution to the wind and said, let's just say this, what we mean. We mean this is Planned Parenthood we're talking about. And so they were very open that this was a targeting of Planned Parenthood and Dr. Secor-Turner's relationship with this research that involved Planned Parenthood. And they listened, in my opinion, to nothing else. They weren't going to go beyond that.
So I want to talk about a little bit about what the testimony was. I didn't see it because this has been a weird semester. I couldn't see much of anything. You and I think Jane Shu went with you?
Yeah, Jane was there in person and I was.
And you weren't given your titles. You weren't given doctor or, by the way, in my field, professor is the higher rank. It's nice to have a doctorate, but being a professor is the thing that you use. That's why I'm using it, since you are a professor. So did that happen, that you weren't actually addressed by your titles?
Yes, that very much happened. It was an interesting experience, that I think, because they were kind of, the intent was not to show up and listen to the information and understand the issue. I think the intent was more to say, we're proving that you're doing something wrong and what you're doing is wrong. And so they didn't address anyone, neither Dr. Shu nor I, by any sort of title, and consistently interrupted, consistently talked over, scoffed at things, sort of laughed when I would say things. Yeah, it was not the most respectful environment for science.
And it was both men and women doing that to you?
No, they were all men in the committee.
See, I didn't know that. That really is bizarre. Anyways, I need to shut up and let other people. Is Katie there?
Okay, yeah, I wanted to share, this was just in response to something somebody was saying earlier that related to a different bill, Senator Jana Myrdal, she had also linked teen pregnancy rates increasing due to a lack of prayer in school. And so she said that once prayer was removed from school, that we saw increases in teen pregnancy and divorce. And so I also feel like with the committee, not addressing Molly as doctor or professor, and they were clearly taking direction from a person who doesn't understand teen pregnancy and like public health initiatives. And I find that to be really, really disturbing that Molly's voice was very much silenced and not seen as an expert in this field with the way the committee talked to her compared to the senator who was really pushing to end this partnership and what she thinks is like the proper approach to preventing teen pregnancies.
Kent has another thing, is Amy added to it about academic freedom. Would either one of you like to talk about that? Your impression of how the universities are going to side in regards to academic freedom?
I just wanted to put in there in response to an earlier brief discussion about how this would affect the university. During President Bresciani's announcements at the Faculty Senate meeting the other day, I just asked him a straightforward question: where does our campus leadership come down on the prospective decision of supporting academic freedom of researchers to partner with whomever they feel is appropriate, or taking the challenge grant money? And I understood him to say in pretty plain English, NDSU would have to come down on the side of foregoing the challenge grants in favor of academic freedom. Molly, you were there. Did you get the same sense?
Yes, I did. And he has mentioned that several times, that now, especially without the additional monetary punishment for the partnership or for partnerships moving forward, that they are very willing to side on academic freedom.
Well, let's hope it's sufficiently philosophical that they would have paid that price too.
Amy, you added that you think it's true about the other NDUS institutions. Do you want to add anything to that? Amy Meyer, sorry.
That's me only repeating secondhand information, so I don't have a good source for that, except that's the word on the street, that the other NDUS institutions were going to do the same.
That is true, that the President Bresciani did convey that to the governor prior to vetoing the veto that he did do, that the 11 institutions did agree to forego the challenge grant if the amendment stayed. I don't know if they've changed their mind now that the penalties are removed or not. I haven't heard an update since the partial veto happened.
Wow. Stacy, do you want to talk about what you just posted?
I'm just not sure that everyone's on the same page with that, because I was told Wednesday or Tuesday to go ahead and cancel Katie Christensen's Safe Spaces class from DCE because of her, she's affiliated with Planned Parenthood. And it was because of the risk it would cause to the challenge grants.
That's not good.
That's shocking.
So, yeah, so that's different than what you all heard.
Yeah, this is the course that was established. We worked on creating the course with some of the prep funding. Initially, it's no longer funded through this partnership, the grant, but the course is still taught independently by Katie as a voluntary offering through DCE for training adults who work with youth how to become better advocates for sexual health for youth. And like I said in my presentation, over 600 teachers have taken that class, or 600 teachers and adults, and it's amazing.
So we're almost at the end of our hour. I want to give, this was not how I expected to end this hour, but I want to give Professor Secor-Turner opportunity to wrap up and have the final word, since you were not given that respect elsewhere.
Well, I just am grateful for the opportunity to tell the truth about what this program is and why it does what it does and what the evidence and science is behind it. And I appreciate a respectful audience that listened and heard that information. And I sincerely hope that, as more people become aware of what this issue is actually about, that it's not about abortion and it's about helping keep young people in our state healthy and mature into sexually healthy adults. I think there's really no one in the state that you're going to find that says that they think this is a problem or that this is something bad. I think most people agree that this is something that's really good for the young people of our state. And I hope people will feel compelled to support it and stand up for knowing that this is the best thing to do.
Well, I want to thank you, and I want to thank the audience for the sort of conversations that one has to have about these issues. If you have any questions, I'm assuming that Professor Secor-Turner would be willing to take them, and we'll put the email. Well, you probably mostly know her email address, or you just send me an email and I'll get it for you. Anyways, go out, have a wonderful day. I see spring has finally sprung. And so thank you all for coming.